as you start to get older, for your body goes through many good and bad changes. Okay, and this can be a very scary time because you start to become restricted when doing the things you love or you want, right? So everybody's different. So changes tend to come at different times. So some men usually also affected differently as they get older because of genetics. And a good example is male pattern baldness, di ba? Yung mga na alam mo natin nagkakaroon na ng shaggy sa gilid ng buhok, no? As some men lose hair, while others may medyo, ako mabuti, medyo makapal pa ang buhok ko, eh manipis na yung iba, but do not lose it completely, okay? So a 50-year-old man experienced many physical changes as a result of aging. Hormone levels, bone density, muscle mass, eyesight, hair color, skin cells, cognition, and immunity all go through noticeable changes after age 50. Many age-related symptoms can be addressed with wide research-backed treatments. As for ladies, as for women, likes, dislikes, and perspectives have undoubtedly changed over time. So, and though you may not realize all the ways, so has your body. And understanding how the stages of your life affect you can help you understand how to adjust your wellness routine as you age. Likewise, it can help you appreciate what stays the same. The importance of caring for your body, mind, and spirit throughout every moment of life's journey. Okay. Same with men on physical changes brought by aging, like body weight, bone density, hair, skin, heart, even breast, di ba? Pelvic and reproductive health. So yan yung mga karaniwang nararanasan sa mga kababaihan sa inyo po, no? And aging changes in the female reproductive system result mainly from changing hormone levels, no? And one clear sign of aging, of course, when your menstrual periods stop permanently. Like this is known as menopause. And menopause is actually a normal part of women's aging process. And most women experience menopause around age 50, though it can occur before the age, and the usual range of age is around 45 to 55. Tama po ba? And with menopause, the ovaries stop making the hormones estrogen and progesterone. And the ovaries also stop releasing eggs like ova at yung mga oocytes natin, no? Anyo. And after menopause, you can no longer become pregnant. Your menstrual period stop, and you have gone through menopause after you have no periods for 1 year. You should continue to use a birth control method until you have gone a whole year without a period. Any bleeding that occurs more than a year after your last period is not normal and should be checked by your doctor, your OB/GYN or your internal medical doctor. When you are, next slide na tayo so that they can see yung mga prepare nating mga slides. Next slide, please. So when you are past 50, you can go on with the slide until you see yung when you're past 50. Some ailments can announce themselves suddenly and painfully, okay? And aches and pains you might not worry much about when you're younger could be a sign of bigger problems in middle age. So next slide. Kasi we will start with yung mga health problems na pwede nating maranasan during this age, no? Maybe 50 or early 50s, no? Natin. Okay? So one example of that health problem is what we call heart attack. Okay? Wow. So as you can see, meron kasi po akong na-research, no, regarding sa heart attack. Okay? In the last 20 years, according to World Health Organization, okay, heart disease has remained the leading cause of death in the world and is still killing more people than ever before. Okay? So that is according to World Health Organization 2019 Global Health Estimates, no? And the Philippines is the worst in Southeast Asia. Okay? 120 out of 100,000 Filipinos died of ischemic or coronary heart disease in 2019, which is as compared to 2015, 103 lang per 100,000 population ang namamatay sa heart disease. And the world record among Southeast Asian countries that lists the ailment is the top cause of death, okay, yung heart disease. And since the Philippines is the number one, it was followed by Malaysia, Singapore, Thailand, and Brunei. So, ganyan ka-worse ang heart attack. So, this is a big one. 735,000 people have one every year. A 50-year-old man has 1 in 2 chance of getting heart disease at some point. Okay? And the most common signs are, ito yung mga dapat ninyong tinitingnan, no? Lalo na pagka yung nagkakaroon na kayo ng attack. No? One is the chest pain. Nagkakaroon din tayo ng shortness of breath and pain in your back. No? And shoulders and neck. So yung talagang sobrang sakit na nararamdaman natin, parang naiipit na yung mga buto na at saka yung mga nerves natin, no? Sa back and even sa neck, no? You might also feel sweaty, dizzy, or like you're going to throw up, no? Parang nasusuka ka na, okay? So your risk is lower, of course, if you are a healthy or on a healthy weight, no? You don't smoke, or you get a regular exercise. So yan yung mga nararanasan natin at saka pwedeng makaiwas tayo sa heart attack, okay? But of course, the right information is very important. The second thing, for the health problem na talagang sudden na nararamdaman ng after age 50 is what we call stroke. No? Sa next slide natin yung makita. And this is when blood doesn't get to parts of your brain like it should. No? And those brain cells start to die. Okay? So get help right away with the if you have sudden weakness or numbness in your face, no, arms or legs, and you lose your bearings or get confused, okay? So and have trouble of speaking. Mamaya di-discuss ko yung FAST, no, that dapat nating tandaan, no, during the time na na pwede tayong magkaroon ng stroke, no? And you have trouble speaking, okay? So you can lower your chances, no, if you keep your blood pressure in check, eat a low cholesterol diet, and manage your stress. You should do exercise and, of course, quit smoking. Okay, you know, in the Philippines, ang maganda naman nito, but of course, still, hindi a story, no, na based on survey and research, no, ang stroke sa atin sa Pilipinas, hindi kagaya ng heart disease, no, na talagang number 1 worst in the Southeast Asia. Tayo pa nga, kung tutusin, pang 5 tayo, no, sa Southeast Asia. Because the country, our Philippines, had a better record of deaths due to stroke after it reported 68.6 per 100,000 population. We are behind Vietnam, which is around 164.9, Myanmar, Indonesia, Laos, and Cambodia, which is 79.5. Okay? But the World Health Organization warned that governments must drastically improve the delivery of primary healthcare services after data show that non-communicable diseases, ito yung mga chronic diseases na yung mga long duration diseases or illnesses, now make up 7 out of 10 leading causes of death. Okay? So, kaya talagang kailangan na pag-iingatan natin to because usually nangyayari to during the past 50, no? Yung maabot na tayo sa 50 and above of our age, no? And sabi nga natin, emphasize ko lang, no? A stroke is a medical emergency. It happens when a blood vessels in the brain burst, or more commonly when a blockage happens, no? Without treatment, cells in the brain quickly begin to die. This can cause serious disability or death. If a loved one is having stroke symptoms, kailangan mag-emergency call na tayo, no? And usually, ano ba yung mga nararamdaman natin? I repeat, numbness or weakness of the body, especially on one side. Okay? And vision changes in one or both eyes or trouble swallowing. And there's also severe headache with an unknown cause. Okay? Problem with dizziness, walking, or balance. So medyo talagang imbalance ka dito, no? Yung mga nararamdaman natin, no? And confusion. There's trouble speaking, understanding others. So yung sinasabi ko nga kanina yung FAST, kailangan tanda natin to, no? Ano ba yung ito yung mga signs, no, na dapat nating sinalang-alang palagi. One is yung F, no, sa FAST, yung face drooping. Okay? So, as for smile, okay? Pero pagka nakadroop yan, possibility of a stroke. Okay? Nagkakaroon ka ng arm weakness or numbness, yun sa A, sa FAST. So, may weakness ka na, parang bagsak na yung arm mo, hindi mo maigalaw. Di ba? And the speech, yung FAS, no, yung speech yun, no, can the persons repeat or a simple sentence, yun yung dapat na pinapagawa natin sa taong nagkaka-stroke, or do they have trouble or slur words? Okay? And the most important thing is time. Okay? So sa FAST. So face drooping, arm, speech, and the time. Kailangan tumawag na tayo ng emergency call, no? If we have yung number ng 911, important po yan. Okay? So, yan yung number 2 problems, no? One is heart disease, second is the stroke. And the third one na talagang nangyayari ito, no, is what we call aneurysm. Okay? The next slide natin. And this aneurysm, many of the lifestyle changes you make to lower the risk of heart disease, stroke, okay? This aneurysm is most likely you can be well, of course, di ba? Kasi iniiwasan na nagkakaroon tayo ng magandang lifestyle, no? Sa atin, no? And this aneurysm happens when the wall of an artery gets weak and bulges outward. Okay? So yun sa nakikita niyo dyan sa image natin. If that walls gives way, no? Pumutok yan. So it can lead to serious internal bleeding or a stroke. Okay? Symptoms can include pain, nausea, no? Yung parang suka ka, nasusuka ka, vomiting, no? Yung may urge of vomiting ka. Dizziness, no? Clammy skin, yung nanlalamig ka, okay? At saka medyo pawisin ang panlalamig mo. And a rapid heartbeat. So yan yung mararanasan natin if we are undergoing aneurysm or yung nakikita natin sa family natin or friend natin na nagkakaroon ng aneurysm. Okay? So another thing na talagang sudden, no, during our age, no, is a gallstone. So yan yung next slide natin. And these are hardened chunks of bile. And this bile is a fluid that helps your body get rid of waste, no? And they get stuck on the way out of your gallbladder, you know, in gallbladder. And as we all know, gallbladder is a small organ below your liver, okay? So they can range in size from a grain of sand, usually nakikita yan sa ultrasound, no? Sa KUB. And to a golf ball, ganun kalaki yung stone ng gallstone nito. And can cause severe pain in your belly or behind your belly button. So yan yung mga signs, no, an indication. And you're more likely to get them if you're, of course, obese, talagang heavyweight, you have diabetes, you have Crohn's disease, which is yung inflammatory bowel disorder or disease, no? So yun yung meron tayong infection sa digestive tract natin, yung Crohn's disease na yan. Or we don't usually exercise. So dyan natin mararanasan tong gallstones nito. Okay? Okay. So kaya talagang importante na regular ang check-up din natin, no? Even to our urologist or to our nephrologist, okay? So or the internist natin, no, sa hospital or sa clinic. Another health problems is what we call acute pancreatitis, okay? Next slide natin yan. Sometimes, okay, gallstones can set this off. So it's like parang kung ano nararamdaman mo sa gallstone, no? Pero akala mo gallstone lang pala, pero acute pancreatitis na pala yan. So it is an inflammation of the pancreas, no? Which makes enzymes called and hormones like insulin that help with digestion. And this acute pancreatitis causes severe stomach pain, nausea, vomiting, and talagang paglalagnat, yung fever, no? And can be life-threatening. You should seek immediately consultation with doctors, no? And medication if you have these symptoms. It also can be caused by heavy drinking of alcohol, no? High levels of calcium, or a kind of fat called triglycerides. So yan yung mga possible na pwede tayong magkaroon ng acute pancreatitis. Kaya talagang sa age natin, hinay-hinay lang talaga tayo sa ating mga activities at saka yung mga food intake natin. Okay? Okay, so next slide. Ito naman yung next. Most common to sa mga seniors natin, yung broken bones. Okay? So this can happen at any age. But your bones may become brittle as you get older and be more likely to break. A loss of bone is called osteoporosis. And it is especially common in older women. Calcium and vitamin D can help slow it or stop it from getting worse. And certain drugs can help you keep bone or even help you rebuild it. Okay? So, yan yung mga usually nakita naman natin in sa ad commercials, di ba? Important of drinking milk is a very good, no? To prevent this osteoporosis, and even a good sunlight, no? During the day. Okay? Ito, mostly nararamdaman natin to. Ang next slide natin is about vertigo. Okay? So if you suddenly find yourself dizzy, you might have vertigo. Lalo na pag kayong nakaupo kayo, tapos biglang tayo, parang naihilo ka. Okay? So yan yung vertigo na, no? It can happen if any crystals in your inner ear, okay? Which may mga tiny crystals kasi tayo sa ating inner ear, no? And which can help you control your balance, no? These tiny crystals. Nag-display siya or nag-move siya, okay? Doon sa ating inner ear. So nakakaranas tayo ng vertigo, okay? Or if we have no control of our balance, and then we get moved around, no? So yan yung mga nangyayari. So you're more likely to get it as you get older, and probably because the crystals aren't held, no, in place as well. Dun sa ating tiny, yung mga tiny crystals niyan sa ating inner ear. So your doctor can treat it with a series of head movement, mga ganyan, no? And that move those particles back into place. Okay? So once na naturuan naman tayo ng ating mga doctors, no, how to do it. So importante pa rin na talagang meron tayong regular exercise of moving our head, no? So that yung sinasabi nating mga tiny crystals na yan ay babalik dun sa place niya, no? So that we will not experience this pagkahilo, dizziness until naging vertigo na siya. Okay? So another slide, another health problems na talagang nararanasan natin ay yung detached retina, no? And as we all know, retina, that is a light-sensitive layer in your eye that tells your brain what you see, okay? If it pulls away from the outer wall of your eye, okay, just like nandyan sa ating image, sa picture, it will not get oxygen and other things it needs. So yung supply mo ng oxygen sa yung mata, talagang mawawala, no? At mag-stop. So you might see floating specks or flashes of light. So yun yung nararanasan natin, yung may mga nakalutang sa ating vision, no? So you can permanently lose your eyesight, no? So immediately see a doctor, no? Right away. Okay? It's more common in people who are very nearsighted okay, or have had cataract surgery or other eye disease. Okay? So yung palang masyadong malapit, yung nahihirapan kang magbasa ng malayo at talagang kailangan near yung pagbabasa mo, prone ka dito. No? Kaya kailangan tayong regular check-up with our ophthalmologist. No? Kasi they have these gadgets or mga machine na talaga nasisilip nila yung back of our eye, no, to see if this retina is working for us. No? So yan yung importante nating ginagawa. Kaya tingnan nyo yung aking background, it's called emergency. Di ba? So yan yung mga dapat nating immediate, no, na gagawin. Another thing for the sudden, actually because of overtime na lagi tayong nakasolve, maganda yung diet natin sa pagkain, no, is what we call the kidney stones. Okay, ako naranasan ko to at the age of 20s ko late 20s, no. So next slide na tayo. These kidney stones are hard clumps, okay, usually made of calcium that form in your kidneys. Siguro in matter of 2 years, maraming ita-dialysis sa Pilipinas or sa buong mundo. You know why? Because so much eating or taking of vitamin C, it may no, pag hindi nyo usually na-excrete out yan ng urine, it may form oxalate in your kidney. Thus, eventually, you will have a kidney stone. See? So kaya kailangan pagdating sa vitamin C, hinay-hinay lang tayo because there are lots of food, fresh fruits and vegetables that we can eat that has lots of vitamin C. Mas madali yan kaysa yung synthetic vitamin C na iniinom natin. And they often pass harmlessly out of your body. But larger ones, no, the kidney stone, no, but the larger one or the larger kidney stone can be extremely painful, no, and cause bleeding or infection or block of the flow of urine. So hindi ka na makaihi. Okay? So they are more common in men, aray ko po, kaya naranasan ko agad yan, than women. And you can help prevent them by drinking plenty of fluids. Water as much as possible, no? Kasi iba, fluid nga, pero ano naman, soda or naka soft drinks tayo. So, delikado rin yun. So, every day, as much as possible. At least mga 2.5 to 3 liters of water a day, 24 hours, no? Or 8 glasses of water na, kaya nga 300 yung nakatakal yung cup of water natin, at least 300, no, ml per cup. So, times 8, it's around 2.4, diba, liters or 2,400 ml of water, no? And the water is the best remedy for to avoid these kidney stones. Okay, so that regularly napapass out natin yan sa ating through the urine, no, sa ating pag-ihi. Okay, so yan po yon. And then another thing na talagang nararamdaman ng mga oldies is what we call pneumonia. Okay, that is our next slide. So people over 50 are at higher risk of this kind of pneumonia caused by bacteria, and not the one caused by virus kagaya ng COVID-19 natin. And this is called pneumococcal pneumonia. So it can be life-threatening. Okay, older people are more likely to get it because your body's immune system gets weaker as you age. Okay, but there are vaccines for it, and they're recommended by doctors usually that everyone can have it over 65, yung mga vaccines nito. As we all know, di ba, this pandemic natin, most common problem na talagang nauuwi sa symptoms ng COVID infection is the pneumonia, no? Lalo na sa phase 2, no? After the viremic phase, yung phase is the pneumonic phase, no? Na kung saan, if we had this moderate pneumonia na na-experience ko during the time na na-hospital ako, talagang mararamdaman mo yung respiratory system mo na nagkakaroon na ng problema, no? Kaya kailangan talagang ingat din tayo. So we should have a very good immune system to fight this pneumonia. Okay? So, of course, regular checkup with our doctor. Meron tayong katawagin yung pulmonologist. Importante po yan, no? So that na-check up yung ating body system. Okay? Another health problem is what we call spinal stenosis. Okay, yan yung next slide. So this develops slowly, but it can make itself known suddenly. So biglaan, no? It happens when the channel in your backbone, no, that holds your spinal cord and other nerves nag-narrow down, okay? So nag-constrict. And usually because of arthritis, okay? So the nerves can be pinched or squeezed, causing pain, numbness, no, or cramps in your lower back or neck. Okay, so it can be treated with drugs. We have a medication for this, or physical therapy, or in some cases surgery. Okay, so yan po yung ginagawa. If we have this strictness nung ating nando sa backbone natin, or even to the neck, no? So another thing is pulmonary embolism. Next slide, yan. Okay, this is when a blood clot gets stuck in blood vessels in one of your lungs. Okay, your chances of having one go up after age 50, and it can be serious. So get medical help, no? As fast as if you have chest pain, no? Sudden shortness of breath and dizziness. Sa yan yung mga nararanasan natin, na-experience natin during the time na meron na para tayong pulmonary embolism. And you also can have a cough that may even bring up some blood. Okay? Leg pains and clammy or bluish skin. Okay? So nag-iiba yung complexion mo, no? Naging bluish na, at saka yung medyo nanlalamig ka na at pawisin yung iyong skin, no? O yung body mo. And the blood clot often starts in your leg. And so an early sign might be swelling or pain in one of your calves. Okay? Doon sa iyong binti, no? Oh. Hindi doon sa may buto, doon sa likod ng binti mo. So your risk goes up if you have had heart disease or recent surgery. Or you were in a cramped position. Pagka yung lagi kang nakaupo, na kagaya ng nasa airplane or car, no? So kaya kailangan talaga we really have to move our body, no? As much as possible. For a long stretch of time na nakaupo ka, nangyayari yan sa atin, no? Yung pulmonary embolism na yan. Okay? So ito naman ang next step, ang next thing, no? Na talagang marami sa atin nakakaranas nito. Overage because of so much mamaya yung uric acid na itatackle ko. Ito yung kutawagin natin yung GOUT, gout. Okay? So yan yung next slide natin. This condition shows up as a sudden pain and swelling in one of your joints. Okay? And often doon sa big toe, nakikita yan, nangyayari yan. Okay? It's a form of arthritis caused by a buildup of uric acid in your body. Okay? And if you take certain medications for high blood pressure, eat red meat and shellfish, no? Or drink alcohol, you're at high risk, no? The soda sweetener known as fructose also raises your risk, and so does obesity. Okay, maglalodge ako dito ng medyo matagal sa gout kasi talagang because overage nabibuild up yung mga kinakain natin na hindi lumalabas sa ating urine, no? At hindi na na-filter ng ating kidney. That's why paikot-ikot yan sa ating bloodstream, no? Yung ating mga uric acid na yan and causing gout, no? At napakasakit po niyan dahil naranasan ko rin yan. Both men and women can get gout, no? But it's much more common in men. Gout usually develops in middle age or later in men and after menopause in women, okay? It's rare to develop a gout before age 30, no? And for people who have developed gout that's young, no? The disease can be more severe, okay? Uric acid can form when your body breaks down purines, okay? So sa mga next slide natin makita yan, no? Yung purines na yan is a substance found in foods, okay? And normally, uric acid dissolves in your blood and passes in your blood and passes easily through your kidneys, kagaya na sinabi ko kanina. But when too much uric acid builds up in your body, forming sharp crystals and around your joints, no, you can have painful gout attacks. Okay? At ang tawag dito yung flares. Okay? Yan yung mga gout attacks na yan. So many people with gout say they don't have they have a tingling feeling in a joint right before a flare starts, yung attack na yan, no? And the pain can be so sudden and severe that it often wakes up, no, people in the middle of the night, and the affected joint is usually red, swollen, hot, and painful to touch. Kahit konting-konti lang, napakasakit niyan, no? Na konting-konting dikit lang ng anything, no? Masakit yan. A blood test can measure your uric acid level, but that's not enough, to diagnose gout. Even people without gout can have high uric acid, and people with a flare can have temporarily normal or low levels of uric acid. To find out if you have gout, your doctor, provider, no, especially yung mga rheumatologists natin, will draw fluid from an inflamed joint with a needle and look for uric acid crystals. Okay? And the shape, color, and appearance of the crystals can help diagnose gout. Okay? And the most common place to have a gout flare is the big toe, as we said. But you can also have attack, no, in your ankle, wrist, no, knee, elbow, or any other joint. So mamaya makita natin yung gout attack natin nandito na sa, ayan, no, kagaya nung nandiyan na sa elbow natin. So talagang nadideform yung ating bone, no, because of this gout attack or this gout, no. When you have a gout attack, usually ang mga non-steroidal anti-inflammatory medicine, yung kutawagin NSAID, no, like ibuprofen, no, might help with the pain. Your healthcare provider or your doctor also may give you a prescription for stronger NSAID, no, like steroids, kagaya ng mga prednisone na yan, no. Kaya pala hindi ako nagkakaroon ng gout kasi everyday nagpe-prednisone ako no. So, or a drug called colchicine, no, napakalit na medicine yan, to have on hand, no, in case you have a gout attack. So kailangan natin yung mga medications na yan, no, para makaiwas tayo dun sa sinasabi nating atake ng gout na yan. Taking aspirin, however, can be a bad idea. Aspirin can cause your uric acid levels to increase, which can bring on a gout flare or make a flare worse. So marami pong mga medicine, no, ang rheumatologists natin or yung mga doctors natin na piniprescribe, even yung mga diuretic drugs, no, yung mga water pills kung tawagin, and even cyclosporine, no, and that can also trigger a gout or a flare or a gout attack, no. That's why it is important that your rheumatologist or your doctor knows about all your medications, no, that you have a gout, especially if they're going to start on a new medication. If you can bear the pressure, no, an ice pack, okay, may offer some pain relief, okay? And gout flares often hurt so much, though you cannot move your joint. That's why it's better to rest it than to stretch it. Many people say it hurts just to feel as a sheet on their joint at night. So just simple kumot lang, no? Sabi ko nga, a simple touch, tapos napakasakit niya, no? So you may want to take off these bed covers, okay? And you definitely don't want to wrap the joint, no? So you may be more likely to have gout because of your genes, but that's not how your gout earned its royal nickname, okay? So historically, gout has been associated with lifestyle full of rich foods, that plenty of alcohol, the kind of diet that only kings, yung mga wealthy people, no? Pero of course, ngayon, right now, kahit mga middle age o mga middle class, no, in socio-economic class natin, usually nagkakaroon ito because of regular intake of alcohol, no? And yung mga diet natin talagang high in uric acid, no? Lalo yung mga barbecue na nasa labas, di ba? Mga internal organs pa yan. So while diet can trigger a flare, we know now that gout affects people regardless of their social status. No? Foods that are high in substance called purines, gaya ng sinabi natin kanina, raise the uric acid in your blood, and that can trigger a gout attack. So some seafood like sardines, yung mga dilis, yung mga anchovies na yung mussels and salmon is rich in purines, no? And as our common meals, no? Like liver, yung mga common meats, no? Yung mga sinasabi natin mga internal organs, no? Like livers and kidneys na kinakain din natin, no? So it's hard to avoid purines completely because they are rich in many foods. So your doctor may suggest you follow a low purine diet, and people with gout should try to avoid foods that trigger an attack. Okay? So of course, pag normal ka naman, wala namang problema sa mga food intake natin. But of course, pag kami nakakaramdam na tayo, tsaka yung mga previous laboratory testings natin that says we have an increase of uric acid, at tsaka meron na tayong mga failure sa ating urinalysis, di ba? Nakikita po yan, no? For the lab test na pinapasagawa natin sa ating mga laboratories. Okay? So as I have said, drinking beer or liquor are high in purines, which can raise uric acid and trigger gout attacks, no? So they also tend to cause dehydration, no? Especially mga heavy drinkers of alcohol, no? So pagka nagda-dehydrate ka, definitely less ang fluid mo sa katawan mo, so it can cause gout attack, no? It can really trigger the common gout problem. So when you don't drink enough fluids, uric acid also builds up in your body, and you can be more prone to a flare. Itong sinasabi nating gout attack. And some fructose sweetened drinks like yung mga soda natin also trigger a flare. Okay? So ano ba yung pinaka-best na best bet for staying healthy with this gout? It's really water. So kailangan maging hydrated tayo palagi, no? So sabi nga natin 2.4 liters of water in 24 hours or 8 glasses of 300 ml of water. Yan po yung dapat na mini-maintain natin. So yan po yun. And your first gout attack usually will affect just one joint, no? And should get better after a few days, no? But as gout attacks become more frequent, they can affect several joints at once, no? And can last for several weeks if they aren't treated. Okay? So you're more likely to get gout if you are overweight, have high blood pressure, or high cholesterol, no? Or even have diabetes, no? Kagaya ng mga diniscuss natin before, last episode natin. And drinking lots of beer and liquor or taking certain medications also make you more likely to develop gout. So cutting out of foods that might trigger a flare is a great step to help prevent gout. But if you had several attacks in 1 year, your doctor may recommend a medication. So sila na po yung magbibigay sa inyo ng mga different medications na yan, including yung maririnig yung mga allopurinol na yan. Di ba? And the drugs actually may cause an attack when you start first taking them, no? Yung unang inom mo ng mga medicine na yan, talagang masasakit pa yung mararamdaman mo. But as you go along, nawawala naman po at you are treated with this gout. So obesity raises your risk of having gout. So losing weight is another way to reduce the risk. Okay? So yan po yun. And as I've said, last sa ating besides causing gout, uric acid also can collect in the kidneys. As I've said, can cause kidney stones. No? And about 1 in 5 people with gout will develop kidney stones. Okay? And they can very, very painful. And if it left untreated, can lead to kidney infections or damage of your kidney. No? At sana po yan ang maiwasan natin. And yan ang ating topic for today. And I hope nakatulong po tayo. And if you like our episodes, our program, I hope you continue subscribing at sa ating Puno Sagip Buhay. At you follow us on our Facebook, Puno Sagip Buhay po. At kung sakali po na-narrate tayo sa ating, or na-miss natin yung ating episode, naka-YouTube po tayo sa Puno Sagip Buhay. tingnan nyo lang po yung mga title natin, no? You can see us there. So